Good morning. Myself Ashutosh Bhosle. I'm here to present the case presentation on the topic that is diabetic foot ulcer. I'm from Naipur Hajipur, Department of Pharmacy Practice. Coming to the next slide, that is my case presentation contain the content of introduction, epidemiology, patient history, diagnosis, chemical investigations, drug treatment, discharge medication, pharmaceutical issue, pharmacist intervention, and conclusion. Coming to next slide, that is introduction. Diabetes mellitus is a metabolic disorder characterized by high blood sugar level. The diabetes is further classified into type 1 and type 2. These are the main both types of diabetes mellitus. Especially type 1 is due to the autoimmune disorder. It is due to the destruction of beta cell due to autoimmune disorder, and type 2 it is due to the insulin resistance. That is beta cell produce the insulin, but it cannot be utilized by the utilized in the blood to decrease the blood concentration of the concentration of the sugar into the blood. uh, then what is the foot ulcer? Foot ulcer is an open sore or wound that occurs in the patient with the diabetes, and it is commonly located on the bottom of the foot. It is called as diabetic foot ulcer. The most significant risk for the foot ulceration are diabetic nephropathy, peripheral vascular disease, and decreased peripheral nerve sensitization of the foot. Infection. Other causes are infection, ulceration, destruction of deep tissues associated with the neurological abnormalities, and various degree of the peripheral vascular diseases in the lower limb. And what is the treatment for this? The treatment is wound debridement should be carried out in all chronic wounds to remove the surface debris and the necrotic tissues. Next slide. Epidemiology. The overall prevalence of the diabetes in the 15 states of the India is 7.3%. The prevalence of the diabetes varied from 4.3 in the VR and 10% in the Punjab, and was higher in the urban areas. It is also estimated that nearly 57 percentage of the adults with the diabetes are undiagnosed in the India, which is approximately 43.9 million. India ranks second after China in the global diabetes epidemic with 77 million people with the diabetes. Next slide. The patient come to the actual case presentation, that is patient data collection. The name of the patient SN. We don't have to disclose the name of the patient. It is the patient confidentiality, and it's patient's personal information. The age of that female is 65 years. Height is 5.5 feet. Weight is 62 kilograms, and the date of admission to the hospital is 17th of December 2022. Coming to the next slide, that is chief complaints. She was admitted to the hospital with the chief complaints of increase in the blood pressure. At home measurement, blood pressure was found to be 180 by 80 mm of Hg. She having also chest pain from the last since 5 to 6 days, having nausea, vomiting, and allergy is unknown to any drugs. Coming to the next point, that is past medical history. While patient counseling was done, she told us that she was pricked by wooden stick. She was on pressing alternate days outside the hospital, and was on antibiotic called amikacin injection given IV. The date was admission of earlier we discussed the date, that is 17. The lab number as 23 oblique slash 12323, registration number 46 19 67, IPD department, that is general ward, second floor bed, and bed number 238. This is general information we can we can get at um, we can get this information at reception. The name of the department is the surgery department. Patient shifted to this department on the 18th of December 2022. Next, the history of the past illness. While she was admitted to the hospital with the chief complaints before that, the past medical history is she having the type 2 diabetes mellitus. She was on insulin therapy. The insulin, long-acting insulin, that is Lantus, it's international units twice daily. That is insulin glargine. She had bowel irregularities, sleep abnormality, loss of appetite, chest pain, last from since 5 days, nausea, vomiting, and she had menopause attained. The family history: in her family, there was no one has the type 2 diabetes mellitus. Going to the next slide, that is diagnostic test. While she was admitted to the hospital, doctor tell some test like CBC, that is complete blood count, LFT, that is liver function test, ABG, arterial blood gas, SOB, shortness of breath, HbA1c ratio, PT-INR, that is prothrombin time or international normal ratio, pus culture, ECG, electrocardiogram, RT-PCR, reverse transcript test, polymerase chain reaction, color Doppler, lower limb, arterial, and venous. Moving to the next slide, that is diagnosis. A 65 years old lady was admitted to the hospital with cheap complaints of wound at right foot since from 7 to 8 days. While investigation carried out, she told that she was pricked by a wooden stick. This is, you can see here, this is the real image while we had taken on patient counseling. This image was clicked before just wound debridement surgery. Okay, next are the vital examinations. The pulse rate is a 70 beats per minute. Blood pressure is 160 by 90 mm of Hg. The SpO2, that is oxygen level, is 98%. Temperature is 98.5 Fahrenheit. The respiratory rates is 18 18 breaths per minute. Next is some blood biochemical investigation. She had done the blood test for the diabetes, like fasting plasma blood glucose level, oral glucose tolerance test, and HbA1c ratio. For fasting blood plasma blood glucose level, normal range is a 110 to 126 milligram of deciliter mg per dl, and for pre-diabetic it is 110 to 125 mg per dl, and for diabetic it is greater than of 126 mg per dl. You can see this is clear that she having the type 2 diabetes mellitus, because there in the result it is she had the result of 190 mg per dl. On HbA1c ratio, for normal patient it is for normal person it is 5.5 to 6.5 mg per dl, and for and diabetic range is above 6.5 mg per dl. And on the result, on investigation, the HbA1c ratio was found to 8.25 percentage, which is above the normal. So she had confirmed that she having the type 2 diabetes mellitus. Next, moving to the next slide, doctor carried out her lipid profile test. Okay, the parameters are cholesterol, triglycerol, LDL, and direct LDL cholesterol level. These all four ratio, these all, okay, huh. these these all ratio are normal, but except HDL. HDL means high density lipoprotein, which is also called as good lipid, which having the function of to carry the blood glucose, to carry the blood fat or blood glucose level towards the heart. And what is the work of VLDL and LDL? They simply carries from the uh, fat or blood glucose from heart to muscle. So we see here that HDL level is less than that of normal. So there is a chances of hyperlipidemia, or say suffering from hyperlipidemia. Coming to the next slide, that a blood test, complete blood count. There are some tests like hemoglobin test, total leukocyte count, neutrophils, lymphocyte, eosinophil, monocyte, basophil, ESR, RBC count, platelet count, and prothrombin time. We can see clearly that the normal level of HB is 12 to 15 gram per dl for the female, and estimated value is 9.4 mg gram per deciliter. So now ask why her hemoglobin ratio is decreased. It is simple reason that uh, diabetic patient having the anemia. Diabetes can contribute to the anemia due to the low absorption of iron into the gut, gastrointestinal bleeding, and through diabetic complication. The causes that is the cause of anemia is there. It is the simple reason that the diabetic patient cannot absorb the sufficient amount of iron from the parietal through the parietal cell from the gut. That's why there is a deficiency of hemoglobin, and the diabetic patient is anemic. Next, coming to the there is a decrease in the ratio of RBC, red blood cells. We can see the normal level is 3.8 to 8.4 mg millions of cubic meters. So there is a what is the reason behind this? The reason is simple, like for diabetic patient there is a diabetic nephropathy, means there is a damage of kidney. The kidney secretes the hormone called erythropoietin, which is necessary for the production of red blood cells, RBC, which is cannot be performed by proper manner. So that's there's the chances of decrease the number of cells of red blood cells. Okay. Then ESR ratio, erythrocyte sedimentation rate, it is also decreased because of lo- less number of RBCs. Next, liver function test. The uh, um, the tests carried out are bilirubin conjugated, bilirubin total, delta bilirubin, HOT, HGPT, alkaline phosphatase, protein, albumin, and globulin. We can see here all the values are normal except albumin. Then why is there any special reason for this? Yes, albumin secretion decreased due to the insulin deficiency. Albumin is the primary protein excreted by the kidney, and there is a low concentration of albumin due to the kidney secretes the albumin through the urine. So it is called as albuminuria. Due to the decreased diabetic, it is due to the diabetic nephropathy. Albuminuria is a usually marker of a nephropathy and cardiovascular disease. It is usually occurring to the diabetic patient who having the damaged kidney. To the next slide, that is renal profile. On physical examination of the urine, and some urine tests are carried out, like pH, specific gravity, appearance, color, and quantity. These all are normal. Electrolyte and serum parameters like urea, creatinine, uric acid, calcium, phosphorus, sodium, and chloride. We can see here that the calcium levels are below the normal. There is a reason that this female have attained her menopause. After menopause, the estrogen hormone and progesterone are not active. That's why uh, these both hormones are responsible for the maintaining the balance of normal calcium level. Okay, that's why her calcium level is decreased. There are more chances of osteoporosis after the menopause is attained. Coming to the next slide, the drug treatment. There are different types of drugs are given. The first drug is a injection of ceftriaxone. Ceftriaxone is a third generation cephalosporin. The strength is 1 gram twice daily. The route is IV. The drug given on the date of 17th of December 2022. Consecutively, the drugs is given on 17, 18. Other days, the drug is not given due to the drug interaction. Okay. Next is a metronidazole. The drug mm, itself is an anthelmintic drug, and the strength is a 500 mg thrice daily by IV route. On the first day, that is 17th of December, was given. Other days, the drug is stopped. Next is the amikacin. Amikacin is an antibiotic. The strength is a 500 mg twice daily by IV route. The date, the drug is the first day of very first day of admission, that is 17th of December. Next is a pantoprazole 40 mg once daily by IV route, and it is given consecutively 5 days on 17, 18, 19, 20, and 21st. Pantoprazole, the drug is a pantoprazole drug for it is H2 blocker, that is a proton pump inhibitor, which decrease the concentration of acid in the stomach. Next is ondansetron. Ondansetron is an antiemetic drug. The strength is 40 mg as per required SOS, as per emergency by IV route. But there is no condition of emesis to the patient. That's why the drug is not given. Moving to the next slide. That is nasoclear drops as per SOS, as per emergency, twice daily by intranasal route. The patient having the decongestion in her nose, that's why the nasoclear drop was given to her on the date 17, 18, 19, and 20. Next drug, that is paracetamol. It is antipyretic drugs, weak anti-inflammatory action, and the drug is given to the strength given in the strength of 1000 mg, that is 1 gram, both a day as per SOS by IV route. It was given on 17 and 18 only. The tablet silnidipine. The silnidipine is itself anti-hypertensive drugs. The strength is a 5 mg twice daily, given by route of oral, and it was prescribed by doctor for 5 days consecutively, 5 days, like 17, 18, 19, 20, and 21st. Okay. Next is a tablet metoprolol. It is also anti-hypertensive drugs. It is beta blocker, and the strength is 50 mg twice daily oral, and it was given on 18, 19, and 20. Next name of the drug is anti-diabetic drugs, that is metformin and vildagliptin. Metformin is a drug of choice for euglycemia. For didn't have the effect of side effect of hypoglycemia, and nowadays it is a drug of choice. It is combined dose formation of metformin and vildagliptin. The strength is 50 mg, frequency twice daily, route by oral, and it is prescribed on given on the date 17, 18, 19, and 21st. Next is the atorvastatin. It is HMG CoA reductase, that is statins, which decrease the concentration of lipid, or it is decrease the absorption of lipid into the liver. Strength 10 mg once daily by oral route. The date on the given drug is 18, 19, and 20. Next is amoxiclav. Amoxiclav is a concentration of amoxicillin and potassium clavulanate. Next, and the strength is 1.2 gram thrice a day by IV route, and it is given on 1920 and very first 21st. Injection diclofenac. It is a painkiller injection, that is, it blocks the action of COX-1 and COX-2 and relieves the pain. And strength is 75 milligrams twice daily by IV route, and it was given on 19, 20, 21st. Coming to the next slide, that is, she had carried surgery. She had minor surgery of wound debridement on the right diabetic foot was successfully carried out. This surgery was carried out under the supervision of a general anesthesian on the date 17/12/2022. Then her wound was fully surgically dressed. Discharge medication. The tablet amoxiclav 620 mg thrice daily for 7 days. The tablet paracetamol and tramadol 325 mg twice daily for 3 days, and capsule domperidone and pantoprazole 40 mg once daily before the breakfast. Injection Lantus insulin glargine 8 units. It is long acting insulin given at night 9 p.m. once daily. The tablet Zincovit, it is multivitamin tablet given once daily, and the tablet Fildagliptin and metformin, that is Filnip 500 mg twice daily. To the next one, that is pharmaceutical issue, drug interaction and risk management therapy. We have to conclude what's the pharmaceutical issue during this therapy. This is the pharmacist's own notes. Okay. uh, Penicillin may decrease the serum concentration of aminoglycoside, so monitor the therapy of the doses. So uh, we have to increase the dose of aminoglycoside while given the drug with penicillin derivative. Next, cephalosporin may enhance the nephrotoxic effect of aminoglycoside. Cephalosporin may decrease the serum concentration of aminoglycoside. So we have to cephalosporin is a cephalosporin decrease the serum concentration of aminoglycoside. So monitor the therapy closely. Monitor the levels of aminoglycoside. We have to increase the dose of aminoglycoside due to the it decreased by cephalosporin. Third cause is a renal impairment with the drug administered of NSAID and metformin. Okay, it may cause the lactic acidosis and renal impairment and toxicity. So we have to alter these both medications or their timings. NSAID like diclofenac may diminish the effect of antihypertensive drug like cilnidipines. Okay, um, so we have to change the dosing frequency or give the dose alternate days. That interaction should be avoided. Next drug is pantoprazole may increase the serum concentration of metformin. So metformin should be given after the 6 hours or as possible as after that pantoprazole action is diminished, then we have to give the drug of metformin. Next, pharmacist's intervention. What pharmacist should uh, do his efforts to change the medication, or what is the pharmacist to avoid the pharmaceutical issue. The pharmacist intervention or pharmacist made his own notes and tell to doctor to make changes. The very first is the oral hypoglycemic agent may cause the severe hypoglycemia, that the sudden decrease in the blood sugar. So instant glucose should be administered to the patient. The side effect of metformin is deficiency of vitamin B12. This is severe condition. Side effect of metformin is vitamin B12 deficiency. A medication of multivitamin should be given. Dose of aminoglycoside should be increased and monitored because the interaction between the aminoglycoside and cephalosporin. Earlier, I just told you that aminoglycoside should be increased and monitored because the interaction between these two drugs. There is a diminishing effect of diclofenac with cilnidipine, so the dose timing and alternate day therapy of this drug should be done. Patient should change the dressing of the wound daily as per standard operating procedure. Patient should strictly follow the doctor's advice given for the diet. In case of any emergency, glucose should be given to the patient as per SOP. Coming to the next, that is conclusion. Patient was admitted to the hospital on the 17th of December 2022 in Department of Diabetes Mellitus, and her consultant doctor was Dr. Masiwalla. The patient was diagnosed with type 2 diabetes and had a right foot ulcer. She had undergone a minor surgery of wound debridement on 2012-2022. A treatment of antibiotics like the drug treatment of some antibiotics, hyperglycemic agent, NSAIDs, that is non-steroidal anti-inflammatory drugs, antihypertensive drugs was prescribed to her, and a treatment course of 5 days was prescribed along with IV sets. After 5 days treatment, after 5 days treatment, she was symptomatically treated and her blood glucose level was normal. Then doctor prescribed her discharge medication and the patient was discharged on 22/12/2022. And these are the references. Thank you. If you have any doubts, you can share with me and just you can write in the chat box. Thank you.